passionate Dr. Kishore. But before we start on today's speaker and today's topic, I would like to introduce WICCI to all of you. I think we have said this several times. WICCI stands for Women's Indian Chamber of Commerce and Industries. It is a non-profit, non-religious, and a non-political organization founded by Dr. Harbeen Roy. And as we are part of the Equitable Parenting Council, and as part of it, we have successfully tried to reach out to parents, not only parents, to everybody out there, and to provide answers to the multiple challenges that they face in the society. And it so happens that we are a team with expertise in different areas. So we have lawyers, counselors, psychologists, educators, and specialists in different domains. And as a team, our journey has been that of excellence, endeavors, enterprise, and of course, empowerment. So before I introduce today's speaker, Dr. Kishore, I would like to share some details about WICCI. Izzy, can you play the video, please?
Good afternoon, ma'am.
Yeah, good afternoon. Azil will please tell you something about the WICCI, and then we can start off.
Okay, ma'am.
Yeah, hang on. Thank you so much, Azil. Most of us have seen this video several times, but this is for those people who have joined. So we are a wonderful team, and we are trying our best to do a wonderful work as well. So before we begin, I would like to introduce today's speaker for you. As you know, today's talk is about dental needs and oral care. And today's speaker is a very, very dynamic young doctor called Dr. Kishore. And I met him just a couple of months ago when I visited a dental clinic. And you know why people go to dental clinic. It's the worst nightmare. It is the most difficult place to be in, as most of you will agree with me. It's more difficult than cracking a UPSC exam or a JEE or even flying off to space. Even paragliding would be easier for me. But that was a very... So I say my prayers and I go there and I meet this young, charming, friendly doctor who put me at ease immediately. I think that is the mark of a true specialist in his field. He makes us feel very much at ease, and that is what he did exactly. Okay, and he has, to his credit, a lot of noteworthy academic achievements. So, besides presenting several path-breaking papers, he has also organized workshops and community activities to spread awareness on dental care So, which is something very useful for the society, not for the young alone, not for the old alone, for the young, and to the society as a whole. He began his stint as a general dentist in Pondicherry in 2015. And right now, he serves as a senior dental surgeon in a reputed dental hospital called Parasus Dental Clinic, where I met him. So, besides organizing door to door camps, Dr. Kishore also gives lectures on oral cancer eradication, prevention, screening, and treatment. So, the list is long, but I don't want to take so much or too much time from him. Dr. Kishore, it was a great honor to have you as a speaker for today's session, and your passion is unmatched. I have never seen such a passionate young person who does so much
Thank
spade
you, ma'am.
before his acting, and it's such a joy to welcome you to this session. So it's all yours now, Dr. Kishore.
Okay, ma'am.
Yeah,
Good afternoon to one and everybody present here.
yeah,
Yeah.
yeah.
My name is Dr. Kishore. I'm working as a senior dental surgeon in Parasu Dental Hospital. Uh, Last month, I met ma'am, Dr. Manjula Rajan, who is very passionate about the need for the dental care for the aged people. So I made my contribution to the today's evening. So I will start with the presentation now. Is it visible to everybody?
Yes.
Yes.
Yeah.
Yeah.
Put
Can I
on
start?
slide share, Kishore. Slide share, Kishore.
I will start the slideshow.
Yeah.
Ma'am, is it okay?
Perfect.
Perfect. Yeah.
Perfect, Kishore.
Yeah. So start with today I'm going to discuss you about the dental needs and oral care for the aged population, most probably. Okay. So my name is Kishore, and I'm thanks to WICCI organization uh, who has made this topic possible to discuss you some knowledge with you today, everybody. Okay. So to start with, you can see in any dental problem, the first thing we will come across is the dental caries. So dental caries, everybody knows that is the tooth decay. Everybody knows that. You can see the slide there. I have put on picture here. To start with, the dental caries is always black in color. You can see a black spot here, right? So from the black spot, you can see it progresses to the next stage, that is in the yellow color part of the tooth. So third stage, it crosses to the that red color part of the tooth. So according to this, the tooth decay will start in a small black spot only. Okay. So this one, it will progress like this. So in any stage, if you see this one, we can treat the patient. Okay. For the aged population, the most probably what happens is we have four things. Okay. First one is the grossly decayed. Then second one is the root caries. Third one is the some upbraided teeth. The teeth may be upbraided. Okay. Third one is already they will filled the teeth that become a caries. Okay. So I will show the dental caries what and all it will be. You can see in a picture, right? So this is the grossly decayed teeth. You can have in the left, you can see some grossly decayed teeth. This one it will look like. If you're not treated the teeth in the early stage, it look like. So if you are not treated this will progress to like this root caries. Okay. Then the other thing what I have discussed is we have previously filled some teeth with the filling. So that filling also will have a secondary caries. So if and all, if you come across like this, first one is a grossly decay, see here. Then second one is some caries will be present in the root itself. Then third is already we have filled some teeth. So that teeth is present with the caries. So what is the treatment? Actually, the treatment is if any stage, if it is in the early stage, like this in early stage, we can fill the teeth. Okay, the treatment is dental filling. Then if it is in the second portion like this, if in the third portion like this, we will do a root canal treatment. Okay. Then if it is like this, the grossly decayed is there, we will remove the tooth. Okay. Can I stop here? Can anybody ask doubt in the dental caries now, or I can continue?
Probably we can wait for the questions at the end.
Yes,
Dr.
yes.
Kishore, is that all right?
Yes, ma'am, I will wait. Yeah.
Yeah, you carry on.
Yeah. Is it okay, ma'am? I'm going slowly, or I want to any
It's
suggestion?
perfect.
Perfect.
No, it sounds perfect. You go,
Okay.
carry on.
So the first part I have finished is that first thing what I discussed what it is, there is a dental caries problem in the aged population that will be grossly decayed. Then that will be a root caries. Then it will be a filled teeth with the caries. So most probably this stage the patient will come in the aged population. Okay, so this is dental caries. Then the most important thing is gum disease. You all come across the gum disease. Okay, gum problem means around the teeth there is a gum, so the pink color is called the gum. Okay, so that become inflammation. So for the first part is the gum problems. Then surrounding the teeth there is a bone present. You can see in this picture, the right corner picture, there is a bone here. So that become a problem, that is the periodontal problems. So if it becomes problem, then it leads to tooth mobility, then it leads to tooth loss. Okay, then I will show like this. It will be, you can see some dirt is present here in the teeth. Everybody, can I hear? Hello?
Yes,
Yeah.
carry on, Peter.
Yes,
Carry
can
on.
the white,
Yeah,
yeah,
yeah, yeah.
that is.
That plaque will be present in the in between the gum and the teeth. So that will cause us the gum problem. If and all it is present, it will change to the second picture. You can see in this picture, it damages the tissue around the teeth. So that is the periodontal disease. So this too is the biggest problem in any age. Okay, not a caries. This is the biggest problem because here the pink part is connected to the blood. Okay, so it can leads to a blood disease. So if and all if it is present like this, it is a serious health problem. We need to cure the problem. Okay. So you can see in the right corner picture, this teeth is a normal. Everybody can see normal. Then in the inflammation part, you can see swollen. The tissue is swollen there. Gums become swollen. Then the third part, the tissues get wasted, so that the teeth become loose. In the fourth, you can see the teeth is almost loose. So this is the progress of the tooth mobility. That loosening of teeth is the cause of the first initial part. This block we need to remove. You can see in the gum problems, this block need to be removed. So what are the treatment for this gum problem and periodontal disease is that we have a dental cleaning, not our toothbrush cleaning. We should professionally clean the dentistry. Okay, in the dental cleaning, it have two parts. One is above the gums, then below the gums. Okay, then the third part is some new technology has come. With the laser also we are doing some cleaning. Okay. Then the fourth is if and all bone loss is there around the teeth, if you want to put a bone, we have a bone graft. So these four treatment are available for this gum problems and periodontal disease. So I am finishing my second part, that is the gum problem. Already I have told about the dental caries. Then the third thing is this slide. You can look at this slide. You have four things very important. This is main for the aged population actually. You can see the teeth here. Some teeth is wasted here. You can see some teeth is not here present here. So this is called attrition. So most probably this causes a tooth sensitivity. So this is called attrition. Then the second part is erosion. You can see the tooth part is wasted here. Okay. The third thing is abfraction. The fourth thing is abrasion. These are the four wasting diseases of the teeth. So this can be observed in the old age population. Okay. If and all it is present, we can fill the area. Okay. This area can be filled. So if you are doing a self-examination daily, you can have a visit like this. If you have a sensitivity problem like that, you can have a look at like this. Anything is present, you can have a look at this. So the third thing, the most probably the problem will come as a wasting diseases. First is a dental caries, second is a gum disease, third is the wasting diseases. Okay. Okay. Ma'am, can I continue, ma'am? Any doubt,
Yeah,
ma'am?
please do. Please do, Dr. Kishore.
Okay. Okay. After this, if the gum problem is present, it leads to the tooth mobility. So the tooth gets moved from their routine places and it get lost. So after the tooth loss, what probably happen is that the other teeth will take that place. You can see in the second picture here, you can see this teeth is coming from that side to take position here. This teeth is coming from this side to take position here. So it get loosened. The teeth will not be in a position. So it get loosens. So what is the treatment plan is that we need to fix this teeth with some wire in the adjacent teeth. The next tooth present is that is called splinting. Or else it's not possible, more bone is lost in this picture, we can tooth removal. So the gum disease will leads to the tooth loss, most probably for the old age population. Okay. So we need to replace the teeth. Okay. So the tooth replacement come as a two things most probably we will do in dentistry. What is the dental implant? Okay. We will put a titanium like screw in the gum. Then I will put a crown portion. This is called dental implant. And the second part is that we will take support from the next tooth and put a dental bridge. So if a tooth loss is there, we will manage it with a dental implant and dental bridge. Okay. This bridge, lot of variety of materials is available. You can see zirconia. This is porcelain fused metal. This is gold. These are different types of crowns. So it may be, if you visit a dentist, you can have a clear idea about this. So this is the consequences of tooth missing. If under any teeth is not present, the alignment will be disturbed. So we need to replace the gum with a new teeth. Okay. Ma'am, is that okay, ma'am?
Yeah, perfect. Carry on.
Okay, ma'am. Okay. And this is the complete denture. If all the teeth is lost, you can everybody have seen if all the gum pad is there, all the teeth is lost, we can have a denture. Okay. So this is the another treatment for the dental old age people. We can have a complete set of tooth. So that is called complete denture. Then this is a new thing which is happening for about 20 years ago. But this is new for our country. Okay. So what probably we'll do is already I've told we will put a screw in the gum area and we will put a tooth there. Like that, we will put 4 type of screws in the gum area and we'll fix a denture. So this is a new denture called implant denture. So it cannot move. So in the age population, they can have a good chewing and good aesthetics, good function. Everything can be done in the implant denture. So, but it's quite costly, but this is worth when you're going for a full mouth rehabilitation. This is quite worth for the old age population. Okay. Then this is another new one. That is, if any tooth is present, we can save the tooth and put a cap like this, and we can put attachment in the denture itself, and we can put a ball like attachment, so the denture can fit, snug fit like that. Like pin, it will be there in the teeth. You can see the picture. We can make some hole in the teeth. Then we put some cap is here. This cap attachment is put in the denture backside, so we can fix it the teeth. So this is tooth over denture. This can also be done if there is no teeth in the oral cavity. Okay. Then, okay. Then I'm going to continue with the teeth spacing problem and teeth alignment problem. So that is called orthodontic problems. Okay. It can be done if the teeth is very close to each other. It's called crowding. If the space in between the teeth is there, it is called excessive spacing. If the teeth is not in alignment, if they are biting in a normal, not in a normal position, it is called cross bite. Everybody able to continue, ma'am? You are able to continue. I'm
Yeah. Carry on.
Okay.
Carry on, Kishore.
Okay. Then this is open bite means the teeth will not in a position to close correctly. Then it is overbite. The teeth is overly closing the lower teeth. Underbite means it's opposite. The lower teeth will come in front. The upper teeth will go back. So this is for everybody. All age people will have this problem. In the old age also, it's present. This is called some these protruder teeth. Most probably the young people will come from this problem only because of the proclination of the teeth. The teeth is present very front to the face, so they will come with the problem. So this is abnormal eruption. The teeth will be present not in the normal position. It will present in different positions. That is called abnormal eruption. So what we will manage is that we will put like braces like this and we'll put a wire like this. We will align the teeth. Accordingly, we will do the treatment. So this is orthodontic problems. And you can see in the right picture, I have put some braces and all. No, this is the method we are doing for 50, 60 years. But now recently, the new thing has come. This is called clear aligners. Everybody is familiar about this because a lot of ads are coming. You can see this is aligners. It's a different pattern actually. It is having some different patterns. Lot of brands are there. This is a new method of alignment. About according to your tooth problem, they will provide sets of aligners. For example, in the upper they will provide 10 aligners. In the lower portion of teeth they will provide 28 aligners. So it is a different set. In the aligners itself, we can have the tooth alignment. Okay. Ma'am, can I continue, ma'am? Any
Yeah,
doubt?
please do. No, no, we'll keep the doubts to the end.
Okay. Okay.
Already somebody has asked something. We'll wait. We'll
Okay.
wait for you to finish. Okay.
Okay.
Carry on. Thank you.
Okay. Is it okay, ma'am? Can I go in this
Yeah.
speed?
Yes.
Is it
Yes.
understand?
Perfect, Kishore.
Okay. Okay. So this is the main thing I want to discuss you. Because the oral cavity, the most common problem and everybody fears of this is the oral cancer. Okay, this is the only fairest part. Rather than caries, gum disease, everybody come with a fear that we have any oral cancer like this. I have this type of lesion is present, this type of tissue is present in my cavity. The patients will come. You can have a look. This is very different. Some redness is there. You can hear some redness and whiteness is there. You can hear the tissue is wasted here. There is no presence of tissues. So this is the oral cancer. Middle stage or advanced stage photos. Okay, like this only it will be present. It will not be present in a normal white ulcers. When we get a traumatic ulcer, we will get some ulcers. No, it's different. You can see in the picture. It is not. It is abnormal from the normal ulcer. So it is called oral cancer. So these are the causes for the oral cancer. The most common cause is the usage of tobacco. Okay, then alcohol, then the oral dietary habits, then comes UV exposure, then male have the most prevalent affected in oral cancer. Age above 50, they are mostly getting the oral cancer. And human papillomavirus is also a cause for oral cancer. And the bacteria is present in the oral cavity. But now we are going to discuss you a main part is called smokeless tobacco is the main cause for the oral cancer because I have worked about 5 years in oral cancer program. Okay. In that, I have noticed that about 80% of the population have the oral cancer, those who are using smokeless tobacco. If anybody is using smokeless tobacco, 80% of chance it may be changed to the oral cancer. The problem is that they will directly place this smokeless tobacco in the tissue itself. See in this picture, they will directly place their smokeless tobacco in the direct contact. So the main problem is that smokeless tobacco will damage the tissues. So it will cause the oral cancer. So we need to take awareness not to use smokeless tobacco. Lot of awareness program is available. So we need to do that. Tobacco is also main problem for the oral cancer. So no, we need to get precaution and avoid from the smokeless tobacco. Okay. Then these are the 9 points I got to preventive measures for the oral cancer. I will read it. Okay. You make understandable. Okay. So first thing is what I've told is avoid tobacco. So you have to zero tolerance. No tobacco should be used. Okay. Next, no alcohol consumption. Then maintain proper oral hygiene. Then fourth thing is 2 monthly oral self checkup. This self checkup is very important because we need to see in front of the mirror anything abnormal is present or any source or any ulcer which is present about 2 weeks above. So within 14 days, it is not a problem. If it again it is happening, we need to check with the dentistry. Then eat cancer-fighting foods like antioxidants, greens like that. Then sixth point is you have to physically active with regular exercises. Then seventh is we need to be vaccinated with the human papilloma virus vaccination. Then eighth is do not prolongly exposed to the UV radiation. The ninth is visit your dentist regularly. That is the main part in this because if we miss all these things, the dentist is ability to find out the oral cancer at the early stage. So this ninth point is very important. Then the first and second is very important. So these are the preventive measures for the oral cancer. Okay. So this is another interesting slide, which comes the every overall health is related to the oral health. Okay. Most probably everybody is now present with not everybody. Most probably all the population most probably affected with hypertension. Then diabetes will be present for everybody. Most probably. Then arthritis is also a common problem. High cholesterol is also a common problem. And whole population also present with Alzheimer's disease and heart disease. Okay. So these are the main systemic diseases which affects the old age population. Okay. So what are the symptoms or what are the problems you can get if and all if you have this health problems? You can see tooth mobility will be present. Any systemic disease is related to this tooth mobility. And most common thing is dry mouth. If you are taking medications for hypertension, it may be a side effect from the anti-hypertensive medication. Okay, that is called dry mouth. And oral ulcers also present. If the ulcer is present in the stomach, it may be a cause for the oral ulcers. So gastritis problem may be a cause. Then gum swelling. Gum swelling means if you are taking diabetes medicine, some medicines will cause gum swelling. Maybe some side effects will be there. And diabetes, the sixth complication of diabetes is the gum swelling. So if you're not taking your gums properly, then diabetes is related to the gum swelling. Okay. Then third is bleeding. Then the other thing is bleeding gums. This bleeding gums is present with the, when you brush the teeth in the morning, it will present with the blood. So the bleeding gums is also a cause for a periodontal problem that already I have explained. Then some people will have a burning sensation in the oral cavity. So this slide is very important that what I'm going to tell is that our overall health is directly related to the oral health. So if and all any problem is present in the oral cavity, it can directly or indirectly leads to the overall health problem. Okay. So maintain your oral hygiene very good so that we cannot get any oral health problem. Okay. So these are the slides which I took to show how we have to maintain our oral cavity. So this is dental floss. You can see it here. This is how we have to remove our plaque in the home with the thread. You can have the thread and in between the teeth you can insert like this and gently you have to move like this. Okay. So this is the usage of dental floss. Okay. You can see the picture. Gently we have to, because the brush cannot go in between these tight gaps. This thread only will go. So this is the usage of dental floss. Okay. Then this is brushing with interdental brushes. If the contact is too little bit wide, we can use the interdental brush. Okay. If the contact is very tight, we can use this thread. If the contact is little more present there, contact between the teeth, any space is there, we can gently insert this interdental brush and we can clean this.
I'll get you. I'll see you.
Okay. So I have already told something about tooth sensitivity is there. Yes. So for this, the brush is very important. We need to use the soft bristle brush or medium brush. Okay. No hard brushes, because the soft and medium will be very good. Okay. Then if the sensitivity is present, don't take any more number of acidic foods or drinks. It will erode your teeth. Already I have told about the wasting disease of teeth. No, it's also a cause because of the acidic foods or drinks. Okay? Then already I told you very, very important thing in the presentation itself is that we have to visit dentist regularly. If and all we will miss something in our self-examination or any ulcer is present, the dental visit will be very much important. Okay. So these the pictures I took for the old age people for maintenance of denture and dental appliance maintenance. Usually, like this, you have to clean your dentures, and you have to put in the night. You have to keep it in a container, well clean container, wash and keep it. Then wash with the running water. These are the pictures for the denture and dental appliance maintenance. Okay, you can have a look in this picture. Okay, ma'am, can I forward and I go, ma'am?
Yeah, please do.
So these are the from the child to the old age. The only thing we have in your hand is daily morning we have a brush. So we need to brush properly. You can see in this picture, the brush should be kept at a 45-degree to the gums. You can see in this picture, the bristles, no, the bristles is placed correctly in the gum area, not in the teeth area. And it's also angled 45-degree to the gums area. So it can clean gently, gentle motion it can clean. So these are the main concept. Because of the improper toothbrushing only, we are getting the gum disease. In our hand, we have only tools brush. So brush properly so that we can avoid that gum disease in our home. Okay. Then I already told dental visit is mandatory and we have to visit at least 6 months once or 3 months once is the best thing. Okay. Then any doubts you can ask me.
Yeah. There is one question from Smita Mehta. She says, maybe you can switch off your slide presentation, Kishore, so
Okay.
that we can see the speaker.
Uh,
Yeah. Smita asked, what if a person is diabetic? So, Smita, would you like to, can you answer that? Yes, ma'am. Yeah. Regarding what was it, Smita? Can you explain your question?
I am
Yeah.
diabetic.
Okay.
So I have condition of rheumatoid arthritis. So I have dental problems like my teeth and all that. So the upper jaw, I had to extract my tooth, two of them, and lower also were gone. So I had problem eating on the right side. Then when I went to the dentist, thinking that it will be implanted, two of them, two tooth which has extracted. But then unfortunately, because of my diabetes and RA, my bone density and all that problem, implant was not possible for me. So I got two tooth denture recently.
Okay.
I'm trying.
You want a solution for a permanent solution for your problem? Because of arthritis problem and diabetes, you're not able to fix the denture. They are telling them. Denture cannot be placed because implant cannot be placed.
Yeah.
So that it will not be stay. Ma'am, this is quite. We can take support from the zygoma bone, ma'am. You can see. Actually, you can see this picture, ma'am. You can.
Okay.
Ma'am, this is visible.
Yeah, we can.
Because the bone loss is there, we cannot place teeth here. So we can take support from zygoma bone, that is called zygomatic implants. That is the advanced implant is present. I'll just show a picture. You can ask the dentist. Ma'am, you can see this picture, ma'am?
Yeah.
But the support is taking from the ear bone, not in the tooth bone. The above bone, some support can be done. That is called zygomatic implants.
Okay.
That can be done. Then other thing what we can do is we can take a CPCT and analyze what can be done, ma'am. Are you okay with the answer, ma'am? You have any doubt?
No, it's okay. Yeah. Trying to. Thank you so much. Thank you.
Thank you, Kishore.
Thank you.
You even have live thing to show us. Very good. Thank you so much.
Ma'am, I will show this is the dental floss actually.
Oh, okay.
Are you able to see? Yeah.
Yeah, we can see. We can see.
Yeah, this is dental floss. This is another type actually.
Okay.
This is for the broad gap. Okay. Then the brushing technique is, I have already shown that we can use like this 45-degree. Gently.
Okay.
Like this. For the upper teeth, like this. For the lower teeth, we need to do like this. You can see how gently I am doing, ma'am. That is the main thing we have to.
Can you lift it a little higher? Yeah, yes, Kishore. Good.
How gently I am doing.
Yeah.
Not like this. Okay. If we do like this, it will be good for us only. Okay. Like this only you can.
Okay. Good. There is another question here from, wait, you can say it yourself, Shabana. Shabana, would you like to ask the question? Go ahead, Shabana.
Yes, ma'am.
Yes. Yeah, please go ahead. Yes,
Doctor,
Shabana.
like my doubt is I feel I have tooth sensitivity in 2 or 3 teeth. So
Okay.
what's the best toothpaste to use? This is one thing. And then at times when we eat in the side jaw, inside cheek, the flesh gets bitten and that becomes wound for few days. So how to take care of that, doctor?
I understand the first one. You were asking the best toothpaste, right, ma'am?
Yes, doctor.
Because the problem is that the toothpaste has only one property. It's give some foaming effect.
Okay, doctor.
The only thing we have in our hand is brush only.
Yes.
Okay. Any toothpaste can be used. In some toothpaste, they added medicine. In Sensodyne and all, they have some sensitivity medicines they have added. If it
Okay,
left for another 4 to 5 minutes, it gets activated and the sensitivity will be less. So it's not recommended that ideal toothpaste is present. It was only giving a foaming effect. When we are cleaning something, no, we need some foaming effect to clean. So for the tooth also we need a foaming effect. So any toothpaste can be used, but don't use the crystal, that salt, that and all is abrasive. We can use normal paste.
Okay,
Second
doctor.
question I didn't
The
understand.
second question is when we bite and
Yes.
eat, both our left side and right side inner cheek, at times it gets bitten.
Stuck. It gets stuck.
Yeah, it gets bitten.
Bitten. It gets.
I mean,
wounded.
yeah, wounded. Like the skin inside
Oh,
the
you're biting your skin.
Yes,
Yeah,
yes,
yeah,
you're
yeah. You're
right.
biting your skin.
So how to avoid that, doctor?
We need to see the alignment of the teeth, ma'am. In some teeth, it is not present. Normally, it is not present. I will show one picture now.
Yes, please. So is this called as mouth ulcer or mouth ulcer is different?
Yeah. That may be a cause. You can see this picture, ma'am. The teeth which is present here.
Yes, doctor.
It's not in the alignment.
Okay.
So it's very near to the tissue.
Okay,
So
doctor.
we need to check whether your teeth is present in the alignment.
Okay.
Or second thing is when you have sharp cusp also, it may be a problem.
Okay. So what is a mouth ulcer, doctor?
Mouth ulcer is the reaction of oral cavity, ma'am. If it's very our body heat or our food pattern like that only. If it's present above 3 days, it might be a problem. Or 14 days, it's continuously present. What probably we will check is any sharp teeth is there, we will check. I will show one picture. You can see this teeth is rounded, no? Here.
Yes.
Now that is sharp.
Okay, doctor.
So we need to grind that.
Okay.
If we will see whether sharp teeth is present or the teeth is in alignment for the ulcer problem. We will see. If and all if it is present, we will do manually small grinding the teeth itself.
Okay, so whatever wound happens inside our mouth, it is known as mouth ulcer.
Yeah. Known as oral ulcer. We need to eliminate one by one. First, what I will look at any sharp teeth is present. Then I will look for the teeth alignment.
Okay.
Then I will ask for any viral infection has come for you. One by one, we will go. Most probably, locally, if any problem is there, the ulcer will come. Because any sharp thing is there, you can bite improperly, the ulcer will come.
Thank you so much, doctor. It's been really helpful talking to you. Thank you so much.
Thank you.
Thank you, Soma, and thank you, Dr. Kishore. Now, there's another query from Soma. Soma, would you like to ask it yourself? Yes, Soma. You can unmute and talk to the doctor. Come on. Soma asks, what if a person is taking immunosuppressant drug and his stomach is sensitive and cannot take any painkillers and also has tooth cavity? So he has a sensitive stomach and cavity. So how do you handle that?
If you're taking a painkiller, you're having any problem in the acidity problem is there? Or
So
you are
my
asking, you're not able to take any
yes,
pain?
yes, because of the acidity,
Uh,
can't take painkillers. So what does the patient do at that point?
okay.
I think that's a query because
Yeah.
Soma hasn't unmuted and talked. I'll have
Yeah.
to interpret the question the way I understood.
Yeah. But what about the immunosuppressant? Because of the immunosuppressant, you are not able to take painkillers.
No,
Yeah.
he wasn't,
Yes.
there. Yes, Soma, carry on.
Yeah. So what we will probably do is, if while prescribing a drug, we will probably ask the patient, do you have any acidic problem? Okay. If you have acidic problem, what we will do is we will give an antacid. Antacid means we have to reduce the acidic secretion because of the side effects of the tablet. So what we will give half an hour before food, we can prescribe pan 40, omeprazole, like the tablet. Then we will go with the painkiller. Usually that will do. And for the immunosuppressant you're asking, I need to specifically take the drug and I need to check with the whether it is causing any side effects that I need to check. Usually what
Okay.
we will do is we will give some antacids or pan 40 or omeprazole before the food. Then after the food we will give painkillers. So that way we can reduce the acidic problem for the painkillers. For the dental pharmacy, for the tablets, dental tablets. Yes.
Okay.
I hope that answers, Soma. Is that fine?
Yes, ma'am. Yes.
Yeah, thank you, Dr. Kishore, again.
Thank you.
So, Shabana has another question. What is the
Yes, ma'am.
best toothpaste for tooth sensitivity?
Yeah.
Yeah, tooth sensitivity. Yeah. Can you answer? Maybe.
We want
Yeah.
to discuss how to solve tooth sensitivity.
No, which would be the best toothpaste
Sir,
for
only
tooth
please give
sensitivity?
your number.
Which toothpaste, ma'am?
Which toothpaste? Yes.
That I already told, ma'am. We can use any toothpaste. Only thing, the main thing is important is brush only. The brush should be soft and not so hard. It's only foaming effect. If you use only the brush, the teeth get wasted. No, we can erode the teeth, abraded the teeth. So we need some polishing agent. That's what the paste is. If you leave a paste like Sensodyne, they have some added medicine for the sensitivity problem. So if you brush more than 4 minutes, it has some effect to reduce the sensitivity. What we'll do is we will give some sensitivity toothpastes there. Chyanam is there, Thermosil is there. That are all in doctor's side we will prescribe. So what we will tell is we will ask the patient to keep a small size of toothpaste in the teeth itself for 1 or 2 minutes. So that it gets absorbed, then we need to brush. It's like a medicine only, topically applied medicine. So for as of now, best toothpaste is not like there any best toothpaste is there. It's only have a foaming effect. Only thing important is brush only. We need a soft or medium bristle brush. Okay.
Thank you. Thank you, Dr. Kishore, again. And yeah, there's Manjula has a question. Is Denta 91 toothpaste a good one to use?
Ma'am, dental?
I think that's the name of the toothpaste from what I hear. Denta 91.
Denta 91.
Okay, yeah.
Yeah, ma'am, there are a lot of toothpaste came, enamel effect is there, dentin effect is there. We usually don't recommend and all that, ma'am. It's a manufacturer.
Gimmick.
Yes, we will not directly tell you can use Colgate, you can use Pepsodent. Like that we can't. So everything has some advantage and disadvantage. So again, I'm telling that this we need to properly use our hand and we need a small force. The only thing we need to is remove the plaque from the gum area. And before night sleeping, we need to clear the gum area with a salt water rinse or brushing. That is most commonly important, rather than we are choosing different pastes like that. Okay. So.
Yeah. George Gopal has his hands up. Yeah, yes, sir. Go. Please carry on. Go
Yes.
ahead.
Yeah, doctor. Hi.
Yes,
Is it good to put
alum, pitkiri, for 2 minutes in the water and then gargle it for a while. Is that okay?
You're asking alum, mercury?
Yes, yes.
No
Alum.
need, no need, sir. Only salt is allowed, sir. Nothing is allowed.
Okay, okay. Thank you.
Yeah.
Thank you.
Thank you for the question and thanks for the wonderful answer. Yeah. Then is fluoride toothpaste better? Asked Melinda.
Yeah, ma'am. Fluoride toothpaste can be used. Yes. Yeah, because fluoride, what it will do is it will release fluoride ions. It will reduces the caries progress. So fluoride toothpaste can be used, but 2 to 3 minutes like that. We need to put the paste in the tooth cavity and leave it. Then we need to brush. The fluoride is very anti-caries activity. We can use.
Yeah. Now there's another wonderful question here. Do you recommend the use of neem stick like we see in Hindi movies and old movies? They go around in the morning using neem stick. Is it a good idea?
For dancing, we will use neem stick and we can dance.
Okay.
But the problem is it will operate the teeth, ma'am. It's very hard, no? Our tooth is present with the enamel. So it is the hardest part in our tooth. So it will abrade the teeth. So gently only we can use this brush. Gently we can use the here. You already noticed, ma'am, I have not brushed in this area because our saliva will clean this area. So if like that neem stick will be used, it will get upgraded. So already I have discussed the wasting diseases, no? That is because of the faulty brushing technique. Our itself over consciously some people will brush for half an hour, some people for 40 minutes, and so the teeth gets wasted. Tooth material will come out. Then the sensitivity problem will be there. When we see the oral cavity, we have the 4 things I have discussed, no, ma'am, attrition, abrasion, that will be present. So what I will usually tell to the patient is because of your over consciousness, you have destroyed your teeth. So no need to brush so strongly and no need to use that neem. That are all old things. No, I don't know why.
Okay. So do you think brushing twice a day is a good idea?
Yes, ma'am. Brushing twice a day is very good.
Okay.
Before sleeping, at night.
Yeah, that's how we were all brought up.
Because at that time only the microbes will be very active in damaging the tooth portion. Okay.
Yeah.
If you're not using, it's benefit for us only. So brush once also no problem for dentist.
Okay. No. We are not coming to you anymore. Okay. And Soma says his stomach is sensitive. I don't understand.
We are very lazy, no, ma'am. That is our best thing in India. So nobody will, most of the population will not brush in the night. So happily we will tell you can brush in the night. Most probably will not do. So that is the main thing for dentist success.
No. Okay. Soma says his stomach is sensitive. I really didn't understand what that means. Soma, can you answer?
That was based
Can you
on
ask the
query. I think that's resolved already.
Okay, resolved, right? Okay. Misbah, what about Misbah? Does that help? I don't know what that means. Yeah. I hope you got it. Can you see that question? MISWAK.
It's a
Misbah,
toothpaste.
can you answer the question? Oh, it's a toothpaste.
Yeah, it's a toothpaste.
Toothpaste.
Okay.
Miswak toothpaste.
Is it good?
Ma'am, that's what I am again telling ma'am. There is no usage of using any toothpaste. The only thing we have in our is brush only.
Okay.
Any toothpaste you come with, I have only one answer.
Okay.
He has to be diplomatic.
No, sir.
Yeah.
I think it's not diplomatic. I think it's quite factual in nature. You're not getting into any brand promotion, but rather giving a very appropriate answer to the query.
That's what exactly. Is the truth. Yeah. In old days, they have used bricks and all. No? So everybody's teeth will get affected. So advanced, they will found this brush. So like that only. For the paste also, they need some foaming effect, though they come with a different attractive, like chocolates only, they have toothpaste. Different type of chocolate is available in market. Like that, different type of toothpaste. Each one has advantage and disadvantage also.
Perfect.
But we need to use any one of them, right?
Yes,
Okay.
yes.
Now, Krishna has a question. Yes, Krishna, please go ahead.
That's the last question, Dr. Manjula. Krishna.
Yes.
Yeah, that's a lot. We'll take the last question, Dr. Kishore. Yeah.
Yes.
Go ahead,
happy
Krishna.
evening.
Yeah,
Happy
evening.
evening. Thank you for the opportunity. And
Thank you.
it was a great session. I mean, we came to know about a lot many things. So my question was like my daughter's teeth has I mean there are like black sort of some like it feels like some denting has been done, right? I mean, in the half of the teeth. So once I just visited to one of the dentists. So she just suggested that it is like just because of fluid. So you use some toothpaste which doesn't have or have very less quantity of this one. Okay, fluoride. Sorry, fluoride. Yeah. So, but still it is like the same. I mean, like both the daughters had developed that thing. So younger one, she's 10 years old. Hers is cured. Now her teeth is like good. But the elder one, she is 14 years. It is still, I mean, there.
It is black in color.
Yeah, it is black in color.
But she is not complaining of any pain.
No, not at all. No pain at all. And like in all the teeth.
Like this, ma'am? This dark color, like this? Not like this?
No, not like this. Not like this.
Not like this?
No, not like this.
Like this, ma'am? Like this, any color changes is there? You're able to see? Some brown spot is there like that?
It's like, like lines, lines, brown lines and a bit yellowish.
Yeah, like this one. But it's not visible here, like this yellowish color. Yeah. That might be a problem of demineralization, ma'am.
Okay.
It's called fluorosis, actually. When your tooth is developing, if it is not getting mineralized, the tooth will look like this. So what we will recommend is some product is there, ma'am. We can use it, tooth mousse, like that. Some fluoride active toothpaste is there that we can apply. And most probably, if I see the patient, it's very easy to tell appropriate. I'm not exactly getting the thing.
Yeah, I understood. Yes, I mean, I just took her to dentist, so they told it's not a problem, but like some tests and all those things done, but nothing came in the test. No deficiency, nothing.
The problem may be two things, ma'am. It is called enamel hypoplasia. You can note this, ma'am. That is called enamel hypoplasia, or it's called dental fluorosis.
Okay.
Or tooth hypomineralization. You can put these three terms in the net and you can visit. You have some solution, ma'am. It might be one of these.
Thank you. Thank you, Dr. Kishore. I think, so that was a wonderful session, Dr. Kishore, and you answered so many questions. Now I'll invite Azil Marcus. She's the national president of the council. She will give you the vote of thanks. And Dr. Kishore, I'm really overwhelmed by your passion, and I wish there were more young people like you.
Thank you.
No, that's it. No, I have never found someone so passionate like you. God bless you. Yeah. Yes, Azil, carry on. Yeah.
Thank you so much, Dr. Manjula, for this opportunity.
Thank you.
And, Dr. Manjula was super excited when Dr. Kishore said a yes, and more important, the efforts that they both put together to ensure that the session goes so seamless, so effortless, that it looks like it's so well planned only because of the umpteen number of sessions you all both had together. So thank you so much.
I'm disturbing doctor.
Yeah. Minimum 3 times a day.
Every other time, Dr. Manjula, we had a run through with Dr. Kishore. Well, wow, that's extraordinary. Like normally, experts come, it's direct. So, but she was super excited that Dr. Kishore is like putting a lot of efforts into the session. So, thank you so much, Dr. Kishore, for first of all accepting our invitation to be the expert for the session, for putting in so much efforts. And like though there are dental is one aspect that we keep hearing right from a childhood, because we keep going through all of that pain and aches from childhood, yet we quite often, even the simple technique of brushing is the most difficult part for us, and the most underestimated part, we quite often miss out on, though it's the most important thing. Thank you for highlighting that, and the other aspects of ulcer, about the cancer related stuff, the about multiple things, the wasting part. It was quite an informative, quite a learning opportunity for all of us. Thank you for bringing about this awareness. Whatever Dr. Kishore has suggested during the session, this is as a part of the awareness session, right? He hasn't checked any of us. So please take the information and go visit your dentist, as he kept repeatedly saying that please visit your dentist. So take that information and go ahead with to your dentist, and then go in for further investigation, right? So once again, thank you so much, Dr. Kishore, for your time, for your expertise with and sharing it with all of us, and for being so lively and patient with all the questions.
Thank you. Yes.
Dr. Manjula, I think needless to say, you have the most person in our council, the most young, the energetic, and the most enthusiastic person. Thank you so much for being who you are, and wholeheartedly always coming ahead, supporting the entire council by bringing amazing experts onto this platform, so that the community at large, the parents, the grandparents, everyone can benefit through the efforts that you're putting. So thank you so much, Dr. Manjula. All the council members who have joined in, who have always been so supportive throughout, and ensuring that more and more such experts come in, and we can reach out to more and more parents from different aspects of parenting. And you lovely participants, thank you so much for joining in. It is uh, arranging a session is, yes, important, but participating gives that extra fuel to our efforts that we put. So thank you for showing up. Thank you. And I hope that you all benefit, and there's one takeaway from this session at least that will change the way you uh, focus on dental care, oral care per se, not only for you but for your family at large. So take care and have a blessed evening, and we will be hopefully sharing this session of today's on YouTube, so that more and more can benefit from today's uh, beautiful, informative, and quite a learning moment that the past 1 hour we had. So thank you once again. Thank you, Dr. Kishore, Dr. Manjula. Thank you so much.
Thank you. Yeah, I would like to thank Dara for the Zoom link as well.
Yes, how did I forget? I missed on that. Yes, Ravi in particular, Dara's husband. Dara is a national council member, but Ravi right now is their face behind Dara's picture. Thank you for being here, for sharing your Zoom ID, and ensuring that everything goes on smoothly. So thank you so much, Ravi and Dara, for giving the Zoom access to us.
Thank you. Thank you so much. And God bless you, Dr. Kishore. God bless you, Azil, and everyone here. Have a great evening, and keep that beautiful smile with all your teeth intact. Yeah. God bless you all. Thank you. Bye-bye. Bye, Dr. Kishore. God bless you. Okay. Bye-bye. Bye-bye.